head of Vic-Chair of National Palliative Care Committee in Lebanon. Thank you, Michel.
Thank you, Mr. Chairman. Ladies and gentlemen, we are going to present this conference with Dr. Anas. We will have the part one, an introduction that I will present, and the second part will be about the communication strategies to convey the information to patients. Let me start by this to show you that the Mediterranean area is a world of inequalities between what is called the north of the Mediterranean and the south and the eastern side of this. I can say that in all these countries, breast cancer is the number one. If we take the rank order in incidence of the 5 more common cancer in these areas, as you can see, most of the countries, breast cancer is number one. Lebanon, Syria, as we know that, and also now I know that it is the first cancer in Greece too. So if we take both sexes for the 5 more common cancers, you see that breast cancer is also the number one, followed by lung, colorectal, stomach, and non-Hodgkin lymphomas. And it is a very important information from the WHO. It is already a perspective about the cancer and mortality in the areas. As you can see in the area of the Mediterranean Sea, the eastern and southern, there is the most the incidence of mortality is the highest in all over the world. And it is 75 to 100% of increase in mortality. It is in this area of North Africa and Middle Eastern countries. And that's why we ask ourselves why this is happening. And that's the question is it a problem of organization? It is a problem of economy only, about the lack of resources, about the lack of healthcare infrastructure. It is organizational, no cancer registry in many of these countries, and no cancer control plans in most of these countries. And we come to the idea that there might be another reason, which can be a cultural reason. There is an ignorance about how to deal with cancer in general, and the problem of shame and misconception concerning the cancer in general, and the breast cancer particularly. We will see where this myth and misconception is coming from. So the myth and misconception is about the death. Cancer means death. We don't cure from cancer. Fear, a fear that we will suffer, there will be a bad, as Dr. Veronique has said, it is a journey which is very, suffering, stigma. It is a problem of helplessness, loss of control, and isolation of the cancer. And we came back to the history, and we go back to the Egyptian area of 6,000 years before Jesus Christ, and we refer to the Iber's papyrus about cancer. You have to believe me that this is the true traduction of this. Otherwise, you can put in doubt. But in the Iber's papyrus, it's telling us that no treatment for tumors, because tumors is a condemnation from God. And Xenos at that time, Xenos was the god of disease and suffering, and we go against the god Xenos. So we should not treat cancer. Another papyrus is from Imhotep. He would describe the breast cancer in such a way that it is like we teach it to our students today, resident intern, how to examine clinically a breast and how we feel with breast cancer. This is a very well description of this. And at the end, the decision was that we should not treat these cancer because no way it will hasten the death. And more recently with Hippocrates, who is a Greek, as you know, our master, Hippocrates, he described many things, but in the same way, he came to say that it is better not to treat the cancer because if you treat it, that you will die quickly. So, is this a myth, a misconception coming from this part of the history? And it is now, until now, we don't pronounce the name of cancer in the area, and we say that which is not to be named. This disease, we don't say cancer yet. So if you see that in Egypt and Saudi Arabia, we say Awram, which the traduction is National Tumors Institute. We don't say National Cancer Institute. So to be fair and not to say cancer openly for people. And of course, the stigma that we are living with, they have a silencing effect. Because people say, why go and do a screening and discover a cancer if we don't treat it and if I'm going to die anyway? So, no screening. So when we are discovered with a cancer, I will not treat it because I will suffer from the treatment and at the end I'm going to die. So they avoid treatment and they go for a parallel treatment, what we know, not the conventional treatment that we know now. And of course, lately, the UICC, Union Internationale contre le Cancer, United International Cancer Control Association, which is the main anti-cancer organization in the world, put the World Cancer Declaration, and in this declaration, we have the target 5, that in 2020, public attitude toward cancer will improve and damaging myth and misconception about the disease will be dispelled. So we hope that we will have this very soon, but I don't think that we have moved during these last 10 years against myth and misconception. I'm sure that we are going to live these myths for several years again. And now I will ask my friend, Dr. Anas, to give you why we have to change our way of communication with people about cancer, because this is the main issue that we have to change this misconception. Dr. Anas.
Thank you very much, my dear Michel. A word about inequalities. In the same country, you can find inequalities also. I will tell you something. I work in France, in the department of Corrèze, 19, in the city of Tulle, the city of past President François Hollande. Till now, till today, some patients talk about the illness that cannot be named. Ils don't pronounce cancer. We saw. Then let's make communication strategies. Communication strategies, it's very important. Sont very important. It's based on practical evidence strategies. including early detection, diagnosis, treatment, survivorship, palliative care, end-of-life care. Health communication is an essential component in each phase of the continuum of breast cancer care. First of all, communication across the continuum of care. Health communication companies use multiple channels to disseminate information and knowledge about breast health risk and to reduce this risk. Second, culture. Culturally sensitive health communication strategies. It's important to develop culturally sensitive health communication programs and policies, especially in limited resource countries as in the Mediterranean area. Culture frames the social norms, frames beliefs, values, and languages. Communication law. Where is she? Law. Communication is a culture-based conception. That's all. Culturally sensitive health communication strategies, culture-specific messages must be gathered from classical local art forms. Why? To present culturally acceptable images of women. Basic educational program using posters, PowerPoint, presentation, and flyers must be adapted to their languages, needs, and beliefs. Look at that. First one. France. Il a montré ses seins, il a sauvé sa vie. He had shown his boobs, then she saves her life. In Syria, if you put this one, you will have a revolution. My head.
No, everybody will follow you.
Oui, follow me. Oh, follow me, oui. Voilà. Voilà. Etc., etc. Voilà. This is in Syria. In Syria always. Lebanon. This is 85, something like this. In Tunisia, thank you, Professor Radi Hamza. See, Radi Hamza, it's him in Tunisia, but is adapted to the local situation. Third, communication and social support, soutien social. Social support is very important. The social support has been shown to be an effective communication strategy. Why? For moderating many negative psychological reactions to breast cancer, helps promote psychological adaptation, such as reducing cancer-related pain and suffering. 4, communication channels. What are the communication channels? The possibility, there are several possibilities. Patient-provider communication, patient-doctor communication, nurse-patient communication, interpersonal interaction between patients and healthcare providers is a primary channel, very important. Family network communication. The family is a primary cultural unit of health education. Social network communication. The social networks, Facebook, Instagram, etc., etc. The social networks are very powerful influences on health beliefs and health behaviors. Local opinion leaders have high credibility and are often ideal sources for delivering and reinforcing breast health messages. 5, communication campaign interventions. They have been used successfully to decrease the prevalence of smoking, to increase consumption of fruits and vegetables, and to increase adherence with cancer screening recommendations. The communication strategies are based on local social, cultural, and economic factors. The communication strategies should include an analysis of the health beliefs, values, and orientations on the target audience. Very important, companies in Mediterranean area should use visual and dramatic imagery that is attractive to specific target audiences and reinforce message because of health literacy of the audience and problems with numeracy also that make it difficult to understand complicated text, complicated message and statistics sometimes, but all the times. Developing media partnership, very important. The media can be a powerful communication outlet. Breast health promoters need to persuade media producers that breast health issues are of concern to their audiences. Print, online, television, radio, film. Execution of public policies for cancer communication. To be effective, health communication interventions need to be, you know that, carefully planned, based on research evidence, strategically designed, carefully implemented, and refined over time, based on evaluations of outcomes. We must make evaluations. Yasser knows that. We are making that in Syria now, especially in limited resource countries. National, regional, and international policies of breast health promotion are needed to guide effective health communication efforts, as you can see here. Then I give the talk to my friend Michel to present conclusion. No, but it's better.
Okay, it's about what we have learned from these two presentations. First, that in our countries, Middle Eastern and North Africa countries, cancer continue to be accompanied with so many stigma. And we have opportunities today because of the new possibility of communication and education and awareness of the public. We should have a positive change. To the prevention, early detection and treatments should be more provided to people that we can cure from this disease, and that cancer is now a NCD. The WHO put it in the NCD, non-communicable diseases. It's a disease like any other disease, not only a mythic and full of misconception. We have to treat it as we treat diabetes, as we treat cardiovascular diseases, neurological diseases. And communication and cancer awareness should be a very important part in any plan for cancer control in the countries. The school system should be adapted to, against this misconception, and we should teach in the schools, beginning in the school, prevention and how to deal with this disease, cancer, as it is a normal disease. And we have to canalize our emotional support to people who have already the disease. And as we did with the tobacco and the nutrition, we changed the mind and we changed the approach for cancer and decreased cancer by education about tobacco control and about nutrition and good nutrition. We should do this translated for cancer. And of course, the cancer is there. We will have it more and more. It is increasing all over the world. It is going to be the first cancer in 2050. So it is there and it will stay. We have to name it, not to say that which is not to be named. We have to name it and to control it. Public education and resource campaign should be organized at a national level. The behavior of people have to change toward this disease. And of course, patient advocacy is very important. We have to mobilize people and associations and NGOs towards controlling this disease. And this will help for the global cancer control. I think that this is the end. The strategy of health communication is a critical component of healthcare and should be implemented across the continuum of care. And every enterprise must adapt the societal field of the country concerned to the characteristic of its population. As Dr. Anas said, every population has its own culture, and we have to adapt our campaign to the country. I thank you very much for your attention.